Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Before we get into our list of questions for today, let's talk a little bit about the budget. We know the supplementary was passed yesterday, and just give us an idea as to what it will be spent on. We know that we have spoken about this before.
Well, there were two sets of funds that were passed for the Ministry of Health. There were funds from the contingency fund that we got so that we can pay for vaccines. And with those monies, we were able to purchase 200,000 doses of Sputnik V vaccine and 100,000 doses of the Sinopharm vaccine. So those monies were used specifically from the contingency fund. We also receive monies from the supplementary budget, and those monies we also allocated some of it to be able to purchase vaccines, more specifically to get vaccines from the CARICOM African Union initiative, and also some additional Sputnik V vaccine. We have also used funds from this allocation to develop some of the critical infrastructure works that is needed right now. This include repairs to health centers and hospitals, and we are purchasing equipment for these hospitals and health centers. In addition to that, the Georgetown Hospital would have received close to $1 billion, and that is for a number of things, including the purchase of pharmaceuticals for patients suffering from cancers, and for pharmaceuticals for patients who would have received transplant and need immunosuppression. So there are a number of things that we are using the funds that have been allocated to do.
All right. Thank you so much, sir. For today, my first question, what are the vaccine numbers like?
So as of today, we have 222,373 persons who would have received their first dose vaccine. So that would take our percentages up to about 45.7% of our adult population, 18 years, well, basically persons 18 years and above, who would have received the first dose of their vaccine. But you probably would have heard me say over and over that getting the first dose does not mean that you're fully immunized. So we are encouraging people to come and get their second dose, and only when you would have completed your second dose can we consider you to be fully immunized or fully vaccinated. So second dose, we have, as of today, 90,157 persons who would have received their second dose. That would account for 18.5% of our adult population now being fully immunized.
All right. My second question to you, well, Region 10 Health Department, they have been exploring, initiatives basically to ramp up their vaccine numbers. I read that they did a house-to-house the other day, so I wanted your thoughts on that. And do you support regions curtailing campaigns to suit their demographic?
Of course, because each region, there are peculiarities in those regions. And we don't want a one-size-fits-all campaign. We want the health personnel and other people in the region to customize the response that is most suitable to that region. So, for example, in Region 8, for example, they have challenges with the terrain. Region 7 right now, because of the floods, they have some challenge in the upper Mazaruni. So different regions would have different challenges, and we would have to work with the people who are there and who knows how to work with the communities so that we can get the best and optimum response. In Region 10 has been from the onset lagging in terms of the number of persons who have received their vaccines. And I'm happy that more and more the community leaders are now talking about getting people vaccinated. I was very pleased to see that the regional chairman made a statement again pertaining to vaccine, and that he and others in the region would be working to ensure that people get vaccinated. The health team in the region, they came up with this innovative idea of going house to house and talking to people, and if there anyone desirous of getting the vaccine, they would give them. So that is working a little bit, because in the first campaign, I think they were able to get 53 persons. And we'll continue doing these types of efforts in the hope that we can get more people vaccinated. The truth of the matter is that unless people are vaccinated, we would not be able to exit this pandemic. So unless all of us receive the vaccine, and then we would not be safe. So to get to herd immunity, all of us would need to get the vaccine.
As we're on the topic of CamCam Campaign, basically, we know that this weekend was really a good weekend, and I've also noted that other regions wanted to take part in the drive-through specifically because that has been receiving really positive reviews. Are there any other regions that would have done that?
So drive-thrus seem to be very popular because of the comfort that people experience in getting their vaccine. And we have been talking to some of the people in other regions. So for example, Region 2 is scheduled to do a drive-through at the Anna Regina Market Tarmac on Friday. I know that Region 3 is also making arrangements to have a drive-through. I think theirs would be on Saturday, and that would be at the Lenora Athletics, the National Athletics track and field facility there. So they'll be doing a drive-through there on Saturday. Barbies, Region 6, they have also been working to do a drive-through, and I think either theirs would be Saturday or Sunday. But again, we can get the specifics for you. But a number of other regions, having seen the success with those that were done in Region 4, would like to replicate it in their regions, and we are encouraging them to do so. We also want to encourage businesses to support the drive-through like they did here in Region 4. As you know, quite a number of businesses came forward. Some of the gas stations like Shell and Guy Oil was out there distributing coupons so that people can get gas at any one of their stations. And you also had other companies that came forward and were distributing T-shirts to those who were fully vaccinated. So in the different regions, I'm sure there are businesses that would like to be part of the vaccination initiative. And if they like to do so, they can contact the RHOs and the other people in the region to see how they can coordinate this effort. I think it has been good that the private sector has been on board with us, and these little incentive goes a long way in terms of encouraging people to come out and get their vaccines.
Okay. My final question today, how many patients are now admitted to the Ocean View Hospital, and how many are in the ICU specifically?
So currently we have in different hospitals across the country, we have about 102 persons. We have 6 persons right now in the Upper Demerara Hospital, or Linden Hospital as people know it. We have 3 persons in the Bartica Regional Hospital. We have 8 persons in Berbice, Region 6. In New Amsterdam and in Skeldon, we have 8 persons. In Maikoni, we have 6. And in West Demerara, we have 8. At the Ocean View facility, we have 70 persons right now. And of those 70, 21 are in the ICU.
Okay, Minister. Thank you so much for speaking with us today.
Thank you very much.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.